Welcome to Damal Consult Career Academy. If you're preparing for your NHS Band 5 nurse interview in 2025, you've come to the right place. In this video, I'll walk you through the most common and important interview questions, along with clear, confident answers that will help you stand out and pass your interview with flying colors. Whether you're a new graduate or an experienced nurse aiming for that Band 5 role, these tips and sample answers will prepare you to impress your interviewers and take the next step in your nursing career. Let's get started. 1. Why do you want to work as a Band 5 nurse within the NHS? I want to work as a Band 5 nurse within the NHS because I am passionate about providing high-quality, compassionate care to diverse patient populations. The NHS's core values of respect, dignity, and commitment to patient-centered care align deeply with my own professional philosophy. As a Band 5 nurse, I see an opportunity to apply my clinical skills, while continuing to learn and grow within a supportive and well-structured environment. I am particularly motivated by the NHS's focus on teamwork and continuous professional development, which I believe are essential for delivering excellent care and improving patient outcomes. Moreover, working in the NHS allows me to contribute meaningfully to the community and make a real difference in people's lives during their most vulnerable moments. 2. Can you describe a time when you had to deal with a difficult patient? How did you handle the situation? In my previous nursing role, I encountered a patient who was experiencing severe anxiety and frustration due to their prolonged hospital stay and uncertainty about their treatment plan. The patient became verbally aggressive toward staff, which made it challenging to provide care. To handle the situation, I first remained calm and empathetic, acknowledging their feelings without taking their frustration personally. I took time to listen carefully to their concerns, which helped build trust. I then clearly explained the current treatment plan and what steps were being taken to address their condition, involving them as much as possible in decision-making. I also liaised with the multidisciplinary team to ensure their care needs and emotional support were met, including arranging for the hospital's counseling services. By staying patient, respectful, and communicative, I was able to de-escalate the situation and help the patient feel more supported and understood. This experience reinforced my commitment to the NHS values of compassion and respect for patients, even in difficult circumstances. 3. How do you prioritize your workload during a busy shift? During a busy shift, I prioritize my workload by first assessing the urgency and clinical needs of all my patients. I use a systematic approach, often starting with patients who require immediate attention due to critical conditions or time-sensitive treatments. I also consider routine tasks and plan to complete those efficiently. Around urgent care needs, effective communication with my team is essentially regularly update colleagues to ensure continuity of care and ask for support when necessary. Additionally, I remain flexible, ready to reassess and adjust priorities as new situations arise. This method helps me provide safe, high-quality care while managing time effectively under pressure. Before we proceed further in this video, I want to take a moment to share something that could really boost your chances of success. If you're preparing for an NHS Band 5 nurse interview, I've put together a comprehensive ebook titled 50 NHS Band 5 Nurse Interview Questions and Answers. This guide is designed to help you feel confident and prepared, with carefully crafted questions and sample answers that reflect what interviewers really want to hear. Best of all, it's very affordable right now because we're offering an incredible 70% discount. You don't want to miss out on this opportunity to get your hands on a valuable resource that can make all the difference. To download your copy, just click on the sealer or fourth wall link in the description box below this video. You can easily order from Sealer.co or through the fourth wall link provided. If you have any questions or need assistance, feel free to reach out to our online customer care representative on WhatsApp or send an email. Don't wait till long. Grab your copy today and give yourself the best shot at acing your NHS Band 5 nurse interview. 4. Tell us about a time you worked effectively as part of a multidisciplinary team. In my previous role as a nurse, I was part of a multidisciplinary team caring for patients recovering from surgery. One particular case involved a patient with complex needs, including mobility challenges and a risk of infection. I worked closely with physiotherapists, doctors, occupational therapists, and social workers to develop a comprehensive care plan tailored to the patient's needs. We held regular team meetings to discuss progress, share observations, and adjust the plan as necessary. My role involved ensuring clear communication between the patient and team members, administering medications on schedule, and providing emotional support. This collaborative approach helped the patient achieve a smoother recovery and discharge plan. This experience taught me the importance of teamwork, communication, and respecting each professional's expertise to provide holistic patient care. 5. How do you ensure patient safety and confidentiality in your practice? Ensuring patient safety and confidentiality is central to my nursing practice and aligns closely with NHS values. To maintain patient safety, I always follow established protocols and guidelines meticulously, including proper hand hygiene, medication administration procedures, and regular risk assessments. I actively communicate with the multidisciplinary team to report any changes in a patient's condition promptly, ensuring timely interventions. Regarding confidentiality, I strictly adhere to data protection policies, only sharing patient information on a need-to-know basis and ensuring all records are securely stored. I am careful to discuss patient details in private settings to protect their privacy. I also continuously update my knowledge on patient rights and confidentiality laws to remain compliant. Ultimately, I believe that respecting confidentiality and prioritizing safety fosters trust and improves patient outcomes. 6. Can you give an example of when you had to handle a medical emergency? What was your role? In my previous role, I encountered a situation where a patient suddenly went into respiratory distress. As soon as I noticed the patient struggling to breathe, I immediately assessed their airway, breathing, and circulation, while calling for urgent assistance from the medical emergency team. My role was to provide immediate basic life support by administering oxygen and monitoring the patient's vital signs closely. I also communicated clearly with the team, providing accurate information to ensure a coordinated response. Once the emergency team arrived, I assisted with further interventions and helped prepare the patient for transfer to a higher level of care. This experience reinforced the importance of staying calm, acting quickly, and working efficiently as part of a team in emergency situations, which are critical skills for an NHS Band 5 nurse. 7. How do you stay up to date with nursing practices and clinical guidelines? Staying up to date with nursing practices and clinical guidelines is essential to providing safe and effective patient care. I regularly engage in continuous professional development by attending workshops, seminars, and online training courses relevant to my nursing specialty. I also subscribe to reputable nursing journals and follow trusted healthcare organizations, such as the NHS and the Royal College of Nursing, to keep informed about the latest research and updates. Additionally, actively participate in team meetings and clinical governance sessions, where we discuss new policies and share best practices. I find that combining formal learning with practical application helps me integrate new knowledge effectively into my daily practice. This approach ensures I am always aligned with current standards and able to deliver high-quality care to my patients. 8. Describe a situation where you had to communicate complex information to a patient or their family. In my previous role as a nurse, I cared for a patient who had been newly diagnosed with diabetes. The diagnosis was overwhelming for both the patient and their family. and they struggled to understand the medical terms and the lifestyle changes needed. To ensure clear communication, I took time to break down the complex information into simple, understandable language. I used visual aids such as diagrams and pamphlets to explain how diabetes affects the body and the importance of blood sugar monitoring, diet, and medication. I also encouraged questions and made sure to listen carefully to their concerns and fears. To reinforce understanding, I arranged follow-up sessions with a dietitian and provided contact details for local support groups. This approach helped the patient and family feel more confident and empowered to manage the condition. This experience taught me the importance of patience, empathy, and tailoring communication to meet individual needs, which aligns with the NHS values of compassion and respect. 9. What would you do if you witnessed a colleague not following proper procedures? If I witnessed a colleague not following proper procedures, my first priority would be to ensure patient safety and care quality. I would calmly and respectfully address the situation by reminding the colleague of the correct procedure if appropriate and safe to do so. If the issue posed an immediate risk to a patient or others, I would intervene promptly to prevent any harm. If the behavior continued or was serious, I would follow the NHS guidelines by reporting the incident to the appropriate supervisor or line manager, ensuring that it is documented correctly. Throughout the process, I would maintain professionalism and confidentiality, focusing on supporting a culture of safety and continuous improvement within the team. 10. How do you manage stress and maintain resilience in a demanding nursing role? In a demanding nursing role like that of an NHS Band 5 nurse, managing stress and maintaining resilience is essential for providing consistent, high-quality care. I prioritize self-care by ensuring I take regular breaks during shifts to recharge, even if it's just a few minutes to step away and practice deep breathing or mindfulness techniques. I also find that maintaining a healthy work-life balance outside of work helps me stay mentally and physically resilient. When stress arises, I focus on staying organized and prioritizing tasks, which helps prevent feeling overwhelmed. I'm also proactive about seeking support from colleagues and supervisors when needed, as teamwork and open communication are vital in managing challenging situations. Additionally, I engage in reflective practice to learn from difficult experiences and build my emotional resilience over time. Overall, I believe that staying adaptable, seeking support, and taking care of myself are key strategies that help me remain effective and compassionate in my nursing role. Do you have any question for us? Yes, thank you for the opportunity. I'd like to know more about the support systems in place for Band 5 nurses here, especially regarding mentorship and professional development. Could you tell me how the team promotes continuous learning and career progression? I'm also interested in understanding the typical patient caseload and how the ward manages staffing levels during busy periods. Finally, how does the team foster a positive and collaborative working environment among nursing staff? Thanks so much for watching. I hope these NHS Band 5 nurse interview questions and answers have given you the confidence and insight you need to succeed in your 2025 interview. Remember, preparation is key. Practice these answers, tailor them to your experience, and be yourself. Don't forget to like, subscribe, and hit the notification bell. For more career-boosting content from Damal, consult Career Academy. Best of luck, and I can't wait to hear about your success.